Hi, everyone, and welcome to our weekly roundtable. This week's discussion, we are focusing on HR implications in the wake of COVID-19. I'm sure that you guys have a lot of questions, and we have hopefully just the right person here to answer them. My name is Jody Skinesny, and I'm the Vice President of Member Engagement at the MICPA. A little bit of housekeeping before we get started. As you can see, we've muted everyone's mic, and that's because we have more than 60 people on this call today. We're really happy that you could all be here. Just by muting everyone, it'll help prevent everyone from kind of talking over or any background noise that could be distracting. Craig, our speaker, is going to do a bit of a presentation for the first part of the meeting. And then if you've participated in our roundtables, you know how this works. We will ask you to type any questions that you may have in the chat feature. And if you just move your mouse, you'll see at the bottom of your screen, within that toolbar, there is a chat there. You can type your question in. We'll make sure that we read that question, and hopefully Craig will be able to get us an answer. So happy that you're all here and are able to join us today. And I'm going to introduce our presenter. Craig Vander is the COO at Tryon Solutions Incorporated. Craig's been there for about the past 7.5 years. Tryon Solutions is one of America's top 10 PEO staffing and HR consulting firms. Prior to his time at Tryon, Craig was a managing partner at Affinity Group. So I am going to go ahead and welcome Craig and turn over the presentation to him.
Jody, thanks very much. Certainly appreciate it. And we welcome the opportunity to talk with everybody today. We're obviously starting off talking about one of our favorite topics here at Tryon Solutions, which we manage for about 500 clients, HR related issues. We generally like to address those in a regular environment, but for about the last 6 weeks, we've been operating in a much more challenging environment and trying to deal with the issues related to COVID-19 as they impact our clients, their operations, and the HR environment. So we all started looking at this about 6 weeks ago internally, even before there was a national or state stay orders in place. And we started saying to ourselves as a team here at Tryon, as this thing started to get hotter and tick up, what are going to be the implications for our clients and really for small to mid-sized business in general, outside of even our client base, as if this thing starts to really grab legs. And as we all know at this point, not only did it grab legs, it became kind of a freight train. A lot of the things that were apparent out of the gate were certainly for us here as a company and a service provider to our clients, we're going to start dealing with things that we've never dealt with before. We're used to dealing with statutory compliance. We're used to dealing with a variety of issues we're going to talk about, but we're not used to dealing with them perhaps all at the same time. And I think that's the biggest challenge that I think a lot of companies, certainly our client companies, and I think a lot of companies around the country are dealing with is certain aspects of HR we expect to deal with. We expect to deal with employee benefits annually at open enrollments. We expect to deal with workers' comp issues, paid leave issues, and things of that nature. What we didn't expect to do is we didn't expect as a business owner to have to deal with all of those issues at the exact same time. So at the end of the day, that's really been our focus, is rolling up our sleeves, drilling down and saying, what are going to be some of the best practices of how you deal with a plethora of HR issues at the exact same time in your small to mid-sized business. So we started this all off, kind of right as the stay orders were coming out, not only at the national level from the president, but at the various statutory levels. Tryon as a company, we service about 500 clients in just about every state, and we have paid what we call worksite employees in just about every state and jurisdiction. So as the orders started to come in, obviously we all know they didn't come at the same time. We started dealing with state orders on the East Coast first with clients in New York and New Jersey. Was not too long after that, we started dealing with them right here in our own backyards here in Michigan, and then in other regions as well. Some of the interesting things that you had to deal with out of the gate is that the stay orders, outside the idea of staying home, there wasn't a lot of consistency necessarily in all of them. For example, in the state of Michigan, you had to start looking at how do I deal with paid leave, because now I'm staying home. Michigan has a mandatory statutory paid leave law now. So am I subject to that? Am I eligible, or am I required to start paying employees under Michigan Paid Leave Act versus do I have paid leave to deal with at all, or do I even qualify? So these are all issues that you had to take a hard look at right out of the gate. I think the bigger challenge that people had to deal with on paid leave was nobody knew how long this was potentially going to last until we got better guidance at the federal level, and then subsequently at the state levels from our governors. And then, for example, here even where we're headquartered in Troy, at the county level, subsequent to the governor's orders, we got a county order. So that introduced another aspect of things, and that was how do I deal with the HR issues of compliance if I have essential workers that are showing up in the work site. Can I allow them in the work site? Do I have to test them? If I have them in the work site, what are my social distancing rules? We did have a requirement here in Michigan, for example, to put a written order together, or excuse me, a written plan together for how you were going to manage through having essential workers, or if you were an essential business, and how you were going to deal with that. And I think the value proposition of that was it allowed a lot of small business owners, certainly our clients, to allow us to consult with them and say, this is broader than just dealing with a statutory order. This is now something that ties into business continuity. And that's the way we should really start thinking about this, even today, as we're hopefully getting closer towards the end of some of the rigid stay orders, in looking to potentially bring people back to work. What is the broader business continuity plan? Because if we open the doors up next week, and we had an operation of 75 employees, and for the most part, only 6 or 7 have been there for the last 5 weeks, how do we incorporate bringing all those people back? So those are some of the things that we had to start working with our clients in considering. One of the other big items that kind of came out of the initial part of this was, what happens to my business when I start laying people off? By the way, can I pay people if they're not working? Because we're hearing that there's going to be this program coming from the federal government, and it's going to allow me to apply for a loan and perhaps start paying for employees. So lots of planning issues there, but they always trickle down into compliance arenas like statutory wage and hour issues, unemployment issues, workers' compensation issues. So lots and lots of things you had to start working through and thinking about. One of the biggest areas that you had to take a look at right out of the gate were unemployment benefits. And this is a big area that we're working on with all of our clients. I think everybody's pretty familiar. Most people I'm sure on the call here have gotten themselves more than familiar enough with the CARES Act, probably more than they really wanted to understand at some point. We all know that under the CARES Act, there's an additional $600 a week of unemployment benefits to eligible claimants in all 50 states. One of the challenges that we foreseen there right out of the gate is historically, we have not experienced, whether it was ourselves dealing with different states, unemployment agencies, or through our partners within Equifax, for example, we've seen that there's never a really, really consistent approach of how the states always collect data and then use that to help promulgate your unemployment experience ratings. The massive impact of unemployment claims, and I think for those of you that have watched the report today, we all know that just in the last 5 weeks, we have in excess of 26 million new unemployment claims in the country. At some point, that $600, even though it's supplemented and paid for by the federal government, and it's not supposed to hit the experience rating of your unemployment accounts, it's also on top of regular state unemployment benefits. Some states are now offering up opportunities to not have the funds that are coming out of unemployment for individual claimants between, say, late March until the end of this episode. to not charge your benefit accounts either. But if we're not managing that properly, the massive amount of unemployment claims that are coming out of the COVID-19 outcomes is going to have a very material potential impact on not only what would be our clients and Tryon, but small business in other businesses around the country have a significant impact, perhaps, if you don't manage it properly over the next year or so. If you don't manage the claims and watch that they're not inappropriately putting funds against your experience rating account, that could have a massive impact on your rate structure. Hence, 6 months, 9 months, 12 months from now, when you thought that expense on your small business was going to be $100,000, it could end up being $700,000. So these are very, very important things that come out of the HR aspect of dealing with COVID-19. This is just one of them we think that we have to pay a lot of attention to. The other thing is do you deal, as it relates to unemployment, how do you want to deal with this? Did you want to challenge claims even if they could be challenged? Is that the right thing in this environment? Are you intending to bring people back to work that may have had a claim challenge? So lots of stuff to consider and manage through on the unemployment aspect. And then, of course, the impact of being able to bring your business back if you had people that were challenged on their unemployment claims and you need the labor force back and they were maybe less than happy or disgruntled about the issue in the first place. Another big area that's really impacted Tryon as a co-employer, and that's what we do with our clients around the country, is we co-employ roughly 50,000 plus people. Our concerns that surround workers' compensation cost, workers' compensation experience rating, and everything related to the whole aspect of workers' compensation. So we provide workers' compensation coverage to over 500 small business and medium-sized businesses around the country. One of the things that's very important, it's a big part of what we do every day, and it's a huge part of really the HR element that's coming out of COVID, the issues around COVID-19, is managing your workers' compensation costs and experience rating so that on the long term that doesn't have a material impact on your employment cost structure. Historically, in the area of workers' compensation in just about all states, something like the COVID-19 virus would have historically been considered not compensable in just about all 50 states for workers' compensation purposes because it is otherwise something communicable to the entire public. There are some limited exceptions to that in some states around the country as it relates to healthcare workers and related industries. But at the end of the day, that was generally not a covered claim. One of the concerns and fears that we had, and we're kind of seeing it now, is that in this very quick reaction that a lot of the states are having, states like Washington, California, even our state of Michigan, and New York, a few other states have already come out and are already giving guidance that COVID-19 claims may be, certainly in the healthcare arena, but in a variety of other industries, may be eligible claims for workers' compensation. Historically had never been an eligible claim. So the concern here is multiple fold. The claim could be something that's immediate. You were perhaps an essential worker. You contacted the virus. You subsequently had to go to the hospital, and you ultimately ended up, and then you were released, and you ended up with a hospital bill of $75,000 it's a workers' compensation eligible claim now that's going to get your experience rating. So that's one type of claim that speaks for itself. But there are other eligible claims. So for example, a year from now, you were an essential worker today. A year from now, you have kind of some challenges that you're dealing with, perhaps as there may be concerns about going to work. You just are afraid to work in the same workplace. So a year from now, you go see a psychiatrist, and they diagnose that because of the issues that came out of your concerns and fears of working in the workplace where you may be contracted the COVID-19 virus, they determined that that's a work-related injury or illness. And now a year from now, you have a claim that could last maybe 5 years. And that claim could be worth $1 million in compensation between lost wages, future lost wages, medical, whatever it may be. And now that impact on your experience modification as a small to mid-sized business could be substantial. So the whole area of workers' compensation is a huge area that's being looked at by just about every state right now to determine if this is something that's going to be a compensable under the COVID-19 rules, we'll say. One of the things we're paying a lot of attention to on that, though, is not unlike some of the states are addressing the unemployment claims issues. For example, even here in Michigan, is that putting the federal additional $600 of weekly funding through July away for a minute. Even statutory benefits in Michigan, they're outlining rules so that if it was driven out of the stay orders, then they're going to not apply those benefit claims against your experience rating. So keep in mind, though, that happens in all 50 states. There's one federal unemployment system, but that doesn't impact your experience rating at the state level. So there's 50 states, 50 unemployment systems, 50 experience rating systems. That applies at the unemployment level, that applies at the workers' compensation level. So these are things that we're paying a lot of attention to make sure that ultimately long-term, we're managing those experience rating properly, we're managing those claims properly so that we can ultimately look to keep the cost down for all of our clients and all of our future clients so that doesn't have a material impact on their burden for labor. And then I guess the other big issue, the other real big issue that came out of this is the whole area of employee benefits. So what we're not seeing today is we're not seeing a massive impact on employee benefits as it relates to current claims exposures. Hospitals are largely seeing, as I think we all are aware of it now, they're seeing, for the most part, COVID patients now. So you're actually deferring voluntary surgeries. You're deferring a variety of things that you were going to do that could impact employee group benefit plans. So the upside, not unlike what we've seen in the price of oil in the last month or so, supply and demand, you're seeing a massive lack of utilization on voluntary surgeries and other things related to that may be a trade-off within your group benefit plans for claims that are driven and related to the COVID-19 virus. But our expectation is they won't outweigh that just because of the penetration of the virus so far versus the larger numbers of people that are on those group plans. So ultimately, at the end of the day, we're not seeing that as much of a concern as we are seeing ultimately what our renewal is going to look like in these employee benefit plans, not in 30 days or 60 days, but maybe at the end of 2020 into the first or second quarter of 2021, and how are these claims related to the outbreak of COVID impacting employers' group healthcare plans as it relates to their experience ratings. So those are the things we're paying a lot of attention to. Additionally, and one of the things I think that just about all carriers are doing a great job at is trying to be proactive and get in front of trying to be proactive healthcare providers. So most carriers that were using telemedicine within their benefit scheme offerings, employers even had self-funding in their plans, HSAs and the like. A lot of these benefit plans now are waiving deductibles and copays for certain things so that you can, if you have to get testing or you're getting telemed related to this, they're waiving those deductibles and copays. Those are great for participants and employees, but at the end of the day, those costs are still coming in. They're going to impact the cost and structure of your group benefit plans in the long run. So we're trying to watch those carefully, not unlike workers' compensation issues, unemployment issues, paid leave issues. The things that long-term we're dealing with now, we have to address with small businesses and medium businesses that are going to have a long-term impact, perhaps on experience and premiums and the like, if we're not taking advantage of the opportunities, the rules, and how to manage those things as we get through the next perhaps 12 to 18 months of the impact on those programs. In addition, in the whole area of benefits, there are some rules that were driven out of the CARES Act that I think are fantastic. I'm sure that everybody on this call is pretty familiar with raising the cap significantly and being able to take loans out of your 401k and retirement plans without penalties, raising the caps on some of the HSA plans. Those are all great things, but these are things you've got to pay attention to and manage because they all have to be paid back so you don't have penalty issues down the road. So lots of things to consider and think about in the areas of employee benefits, in the areas of tax issues, workers' compensation. And then ultimately, at the end of the day, the last piece I think that is just as important that we're starting to deal with clients now, and hopefully the entire country is going to deal with within the next 30 days, is getting everybody back to work, and that's a big deal. And from an HR perspective, what are the best practices of dealing with that to bring everybody back? For example, just in our own offices, we employ about 140 people in our 3 operation centers. We have in excess of 60% of those people that are working remotely. Our intent is not to bring that 60% back at the same time. We have a strategy to bring them back 1/3 over 3 different weeks, for example. And then our practices are going to be, what are we doing in the work site today with the staff that's been essential and hasn't left versus the staff that's been working remotely, and how do we properly integrate them with the current staff and keep a level of comfort from an HR perspective so that people don't have concerns that they're running back into the work site and maybe running back into a health related challenge just by coming back to work in general. And we have a lot of clients in that same scenario today. We're fortunate enough that we're in quasi protected business where that we are defined as essential in a lot of aspects of what we do. So we've got a good number of our own people on staff, but we have lots of clients that are shuttered from 200 employees all the way down to 5 essential employees. So lots to think about when bringing them back to work, including making sure that we have a clean and safe work environment. We expect there's going to be future promulgation of rules coming out of OSHA, MyOSHA, other OSHAs that are going to be driven out of dealing with post-COVID-19 in the work site, and how are we dealing with those things as we're bringing our employees physically back to the sites. So again, looking in totality at where we're at COVID-19 and the response from an HR perspective, where were we at on the front end? How do we deal with it hopefully very quickly here on the back end and getting everybody back to work, and then managing those aspects throughout the middle of all of this, so that we don't wake up 18 months from now and when my labor burden used to be 18%, it's now 32, and it has an undue hardship on the business. So those are a few of the thoughts we had in mind to talk about, Jody, if that makes some sense.
Absolutely. We do have a couple of questions already coming in, and of course I encourage anyone, if you do have questions at this point, to go ahead and type them into the chat. From Mary, do H-2B program wages or new hires count toward the 75% wages required for the forgiveness of a PPP loan? I know H-2Bs didn't count when applying for the loan. Thoughts on that?
Yeah, so the new employees, definitely that's going to be accounted. So remember, it's the qualification period. So if you're bringing in new employees to help run the business, that's certainly not going to be an issue. The H-2B, I think, is a question that's still going to be a little bit determined. They're continuing to promulgate rules as it relates to non-citizens, even as of yesterday. You saw the new executive order from the president, really basically stopping all immigration. That's trickling down through the DOL at a variety of levels of issues as it relates to compensation? Is it qualified? Is it not qualified? So I think that the rule is not, and let me just step back. I'm sure everybody on this call has spent a ton of time reading through the final rule that was issued on the PPP SBA loans. They're still fairly vague and ambiguous a little bit. We're expecting a lot of clarity to come. You know, something, for example, even on the $100,000 threshold and qualifying, there's a lack of clarity still on can I spend $100,000 during the 8 weeks, for example. The final rules need to provide some additional clarity there. So I would say we definitely continue to watch. We expect further rules to come out. Just like the night before you could start applying for the PPP loans, they made rule changes. So we expect some additional rules that yet to be promulgated. And great question, though.
I had a question that was actually emailed over to me earlier in the week from Kim. If we hired an hourly employee and started them just prior to the Michigan executive order and find that we may have to lay them off, should the executive order be extended, could they qualify for unemployment under these circumstances?
Sure. So qualifying for unemployment in general is going to be driven out of your eligibility over the past 18 months in Michigan, for example. In every state's a little bit different. So whether they started a day before the stay order was issued by the governor, or if they started a week before or 10 days, it's not going to impact their eligibility. If they were laid off post the stay order, for all practical purposes, most of the claims that we've seen, and we've seen clients support this as well, claims that came in post the issuance of the stay order are all being approved. And generally at the state level, even claims that are being challenged, some of those are slipping through and being approved, which is also why you really want to pay attention to that. If you do have, not to sound, with a lack of emotions here, if you did have somebody that was fired for cause, for example, post the stay order, and you have a claim that you can challenge, you have to pay attention to that, because generally what's been going on is they've been approving all the claims just because, and I'm sure you've watched it, just because of the plethora of claims that have been coming through. They had to hire 500 additional staffers at the Michigan, for example, the Michigan Unemployment Office, just to manage claims.
Yeah. Another question from Doris. If unemployment claims will not affect an organization's experience rating, does that mean a nonprofit that is a reimbursing employer will not be liable for the dollar-for-dollar reimbursement to the state that is normally required with an unemployment claim?
So that's a great question. Theoretically, that should be. Now, that's a rule that is yet to be defined, though, by the unemployment agency. If you follow the current rules are, as a reimbursing employer, you are reimbursing only those claims that are deemed to have been eligible claims under your account. Following the logic that's in the guidance that's already been issued by the state of Michigan and other states, if those claims are not going to be used against your experience rating account, then a reimbursing employer theoretically should not have to reimburse those claims as well. But again, going back to the measurement, you're going to want to pay attention to and keep great documentation of when somebody was laid off and it was driven because of, say, a stay order, and you want to have that documented well. So if a notice shows up from the state of Michigan Unemployment Agency and it says, hey, we would like you to reimburse this claim, you want to be in a position to defend it using the rules that are already in place, even with a lack of additional rulemaking.
Okay. Do we have more questions? You guys are a really quiet group today. That's unusual. Although I think that Craig's done a great job of explaining, which may be part of why. Oh, wait, now there are a few more coming in. Oh, Doris, sorry, I pushed the enter key before I extended. Part 2, is the Michigan portion of the unemployment benefit also not being charged to an organization's experience rating? And part 3, until what date?
So the general rule now, it's not going to, right now, it's not going to be applied to your experience rating post the governor's, as of the day of the issuance through the end of the stay order from the governor. That would be the guidance right now. That's subject to being extended, perhaps, if we have a kind of a step up approach back into the work site. We think, but right now that would be effective as of the governor's initial original stay order, and for claims that were supported because of the stay order and not being an essential worker, and you want to have that supported and documented. And then ultimately, to what date? That's still to be determined a little bit. I think that my guess would be that it's not going to be as of the end of the order. It's going to be till you can reasonably show that you brought non-essential employees back to work in a safe manner or something like that. You're probably going to be able to argue that those claims should have fit into the category of not being chargeable.
Michael asks, if you represent service businesses and they have been working from home, can they apply for the PPP loan? Do they meet eligibility?
Yeah, so we've seen just about every style of business apply for the PPP loan, and of course, even if you're not really paying anybody, you can still apply. You could be granted the loan, and then you can bring people back to work. So lots of scenarios. So absolutely everybody. So the very first thing that we told every one of our clients the day they said the legislation was going to be introduced, we said, everybody apply for the loan, right? So that's the best thing you could do, regardless of what you do, what your business is, apply for the loan. It's incumbent upon, your lender to make sure that you qualify. And then when the SBA signs off and supports your loan, then ultimately at some point, Jody, you and I were talking about this earlier, at some point, these rules are yet to be determined. It's going to be incumbent upon your lenders to help you get through the process of forgiveness. So we would say there's, and especially our clients, we've got this down pat, all the support you need. Apply for the loan because it's a great opportunity.
That's a really good point. More questions. These are really great questions, and don't be afraid to ask, because if you're wondering, I'm sure there's somebody else on the call who is wondering the same thing. And you were saying that, Craig, that you have, really the structure in place for the documentation, which has been really pretty lacking in the loan process itself. So just always a good idea to kind of, as you're advising clients, talk to them about what the documentation looks like, because we don't exactly know what the forgiveness is going to look like. So that extra level of documenting everything, could come back and really help on the other side of this. A couple more questions. From Michelle, if you've yet to be approved for the PPP loan and the business is struggling due to lack of work, can a salaried exempt employee's pay and commission be cut to save money?
Yeah, so that's a great question. What you've probably seen, for example, right here in our own backyard, I think it was only about 2 days into the stay order, something in that arena, where the CEO of General Motors cut salary employees' pays across the board, company-wide. And that's something that, outside of outside of an organized environment with a union and an agreement in place, a private employer can do this. I would suggest, if we had a client that wanted to do it, or anybody had a client that wanted to do it, that they certainly make sure they're being proactive and having a good communication with employees on why they're doing it, right? And the intent here is not to leverage a bad situation so that we can reduce your compensation in the long term, and when we intend to perhaps try to take you back. But there's no DOL prohibiting practices on that. But I would think at the end of the day, the other thing you're going to want to do too is come up with a plan reasonable plan. When I ask somebody to cut their compensation, how long do I think, kind of post getting everybody back to work, how long will it take us to get back to normal? When can I expect my compensation back? Or maybe even coming up with a strategy that says, hey, listen, everybody's got to pitch in. We're looking to cut compensation on salaries, but we're going to come up maybe an incentive comp plan next year to help offset what we lost this year.
Great. Question from Judy. Any advice for coming back to work plans?
Boy, that's a great question. We probably have a lot of it. I mean, I think the number one thing is you got to kind of take a look at your own environment and your own operation and say, what are the issues and concerns that have evolved over the last month or two post COVID-19 in our workplace that we need to be proactive about moving forward. I'm sure we're watching it every day, all over every kind of media. The world is changing as it relates to social distancing. So if I had a work site before where we had maybe a ton of people working in an area, they were all 2 feet away from each other. How am I going to manage that work site, even if I have a stay order removed next week? How am I going to manage the work site as it relates to probably new best practices to having a safe environment post COVID-19? So you're going to want to look at, the operation itself without people, bringing people back. How do I best manage having people work together in the operation and everybody feels it's a safe environment, certainly for some step up period of time. And then one of the things that we're recommending to everybody too is as we look to bring people back, we're doing it ourselves. We're still going to, when we bring people back, we're going to practice some of the guidance that you already have. If you're an essential business today, there's a number of there's a checklist of a number of questions that you need to be asking your people today as an essential worker that you're probably going to use as a best practice, even post the stay orders, and you have non-essential workers coming back to the work site for some reasonable period of time, which is probably somewhere between 3 to 6 months, acting as though we are looking to bring essential workers back to work every day and using those practices as if we're still dealing with that in the work site.
Mm-hmm. John asks, what particular sets of problems are your hotel, restaurant, and or retailing clients experiencing, and what are you advising them in particular?
Boy, lots of challenges for sure in those spaces. We even have clients, which was a much broader concern of ours in the beginning, was we have a lot of clients in the assisted living and home care business. So I would throw them in as well. We've seen a lot of people that have done a decent job, for example, in hotel and retail or hotel and restaurant with being able to take advantage of all the programs that are out there, because under the CARES Act, we're not just dealing with the payroll protection loans, but you've got a bunch of other opportunities. We've got clients that are taking advantage of the deferral of Social Security payments, taking advantage of 50% of those eligible paid leave on Social Security deferrals. So managing all of that. And then as we look to bring people back into the work site in those different industries, again, making sure they got new best practices. So if you're in the restaurant space and you had 6 people on the line before in the back, what do we need to do different? And we have our risk management people working with some of these clients already, even though they haven't brought them back. What are we going to be doing different where we have a line in the back of the restaurant where we had 6 people next to each other? What do we want to do as a best practice moving forward? So we got to think through those. There are some association programs out there too for some of the, for example, we've got a number of clients that own small hotels and motels. And I know that some of their associations are giving great guidance on industry specific opportunities as well.
Great. From Mandy, do you have any suggestions on how to compete with unemployment benefits when bringing back employees who might be making more on unemployment than they were when working?
Well, that's becoming the biggest question that I think small businesses are dealing with as they are considering coming back. We actually had a client, for example, last week, we spent a ton of time on this issue. They had about 50 employees. I think almost all but about 5 were furloughed. They got approved for their PPP loan and they got funded, which is great. But they had about 70% of them that, unfortunately, the incentive right now in Michigan to pay me almost $1,000 a week on unemployment benefits was twice the comp of a lot of the people that they were going to get just to come back to work. So The challenge that a small business has to deal with there, really any business is dealing with that, is you have to make a decision if you're going to mandate them coming back to work, because the only way you're going to challenge those benefits is if you make the offer and they refuse to take that back. It's a delicate balance, obviously, right? So you understand that that's going on, but you ultimately you have to run your business. You got to try and maintain your business, and to the extent that you have PPP funds and you ultimately want to have those forgiven at some point, you may be put into a position where people are refusing to come back because of this unintended consequence of the additional federal unemployment benefits. It's best to stay home and make more money. You may have to dealing with the challenge of saying, do I terminate that person for failure to report? And then I challenge the benefits down the road, and then get a replacement who will come back in, and I can deploy my payroll protection funds.
From Jerry, a client cut all employees' compensation by 20%. Now wants to restore 100% compensation to employees making less than $40,000. I indicated concerns about discrimination issues. Your thoughts?
Yeah, that's a great question. Again, if you're outside the bargaining agreement environment, where you have a contractual obligation on set compensation, and generally we have some clients in the union environment. We haven't seen any unions at this point relaxing the rules by any means, but outside of that, you generally have the right to do a number of things, and especially in this environment, in cutting compensation. So that's a decision you have to make. I don't think you're going to be challenged at the DOL level in any way, shape, or form from a discrimination standpoint. One of the things you do want to be cautious of is there are protected classes right throughout the entire workforce. What you don't want to do is have a compensation scheme for bringing somebody back, and somebody in a protected class are the folks that are being impacted by lower wages more so than an unprotected class. So I would first look to the rules of how are we applying that compensation reduction? Are we being fairly even about it? As long as I'm within a class, hourly versus salary, for example, I've got less of a concern there. Again, as long as we're not within the class, making decisions that may look like down the road, hey, was I reducing wages on a protected class during this period of time?
Mm-hmm. From Rochelle, what is the liability if an employer does everything recommended and someone still gets ill?
That's a great question, and we've actually seen that. We've seen that with current active clients. Candidly, we had an employee in our Miami office that contracted the virus, and great news is that they're already back to work, so that's good. The liability is really potentially a workers' compensation related issue if they can show that they were at work during the time that they contracted the virus. Really no additional liability from the perspective of a tort claim or something like that, unless you were asking them to do something that was illegal or prohibited or something. But there is the potential for a workers' compensation claim, because again, more and more states, and we're still very early into the process, more and more states are already coming out of the gate saying, hey, generally this was a historically not a compensable claim, but it's a compensable claim now. So, and we're less concerned with that, especially with guidance that just came out of what's called the NCCI, National Council on Compensation Insurance. It kind of sets the rules and governs all 50 states workers' compensation agencies. And they're kind of starting to give guidance already to say, hey, generally those claims that would have came out of a communicable disease that were not compensable in the past, they're going to be compensable. It's the right thing to do. But we may not include that against the experience rating for purposes of your modification factor. So I think that's good to see.
Okay. From Doris, for an employee who is at risk because of existing medical conditions, would the Americans with Disabilities Act protect them in the area of reasonable accommodations to continue to work at home? What about a person who's not at risk themselves but who have a family member who are at risk?
Sure, that's a great question. We dealt with that ourselves internally, and a lot of clients had to deal with that. Right now, until we kind of get much more clarity on, kind of getting back to some normalcy, the recommendation that we've made to our clients and we're using ourselves is that we're following the CDC guidelines. And if you walk through the CDC guidelines of who should be in the workplace and who shouldn't be in the workplace, somebody that has a pre-existing condition or something that predisposes them perhaps to the COVID-19 virus is somebody you should not have in the workplace, in that just as a best practice, and or if somebody in the home. So for example, if you've got somebody who has a spouse at home and they've said, hey, listen, I wanted to let you know my spouse has diabetes and a heart condition, the position that we're recommending with our clients is make sure those employees are given leave, let them exhaust any paid leave. If they can work from home, let them work from home. But somebody that has a predisposed condition, pregnant women, in other categories from the CDC that they've defined, including even the Michigan Department of Health, is to not have those folks in the workplace, so that ultimately, hopefully, we don't have to get to dealing with. We're already ahead of that. We don't have to deal with the ADA on anything there.
That is a good question. From Kristen, what steps are recommended to keep staff safe at a client location? We can take steps within our own offices, but controlling safety at a client location and with travel is going to be much more difficult.
Sure. Great question. Well, one of the things that we're exercising today and the whole world has got to know pretty well is Zoom. So to the extent that you can use technology tools, really to avoid those location visits in the first place, it's probably a great thing to do. Although from a best practice standpoint, if you have to physically be in the work site of a client, probably until we get better guidance right now, using some of those best practices of social distancing, probably wearing gloves if you're going to be touching, office equipment, or if you're going to be touching desks and things of that nature. There's a lot to be said about the utilization of masks. We've heard, 5 weeks ago it was a really bad idea. Yesterday it's a really good idea. Who are we really protecting? I think the social distancing guidance, just in general, if you're exercising that at a client, then you're probably practicing. You're probably practicing a great exercise, or you're exercising great practices to avoid that. But again, if technology is fascinating, if you can Zoom with a client and you can upload files and all that kind of stuff, I think a lot of people are getting used to working on the computer.
I would agree. We've got, look at this, 67 people here today, just hearing all these answers and getting their questions asked, and this has become kind of the new norm in how we get together. Let's see. Okay. Carrie said that she hopped on a little late, so she's not sure if it was asked. Any recommendations for hiring during this pandemic?
So that's a great question. Unfortunately, we're not seeing enough of it, but I think we're going to start seeing more of it now with the first round of all the PPP funds being deployed, and with any luck, maybe by tomorrow having the second round of funding signed off by the president. Great question on hiring. Probably want to use the same practices you used in the past from a hiring perspective. Even though you may be in need to quickly get staff, I think it's important to follow your own practices and policies if you had them. So if you had a practice of doing background checks on employees, if you had a practice of checking on references to the best of your ability, all those kind of practices, I wouldn't change those. The only other thing I would do is have you enhanced your practices a little bit? Are you using, for example, if you're going to come to work in the work site, are you using CDC guidelines now? Are we for new employees? Are we doing temperature testing, or am I asking you a list of 7 questions that the CDC has said I'd like to have answered just to make sure it's safe to be in the work site? So I think those are some good best practices. But certainly now's a great time to hire. A lot of people are, as we know, a lot of people are looking for work. So if you're a bidder in the marketplace right now, you're probably in a good spot to find some talent.
That's very true. Um, Carrie follows up with, what about thoughts on landscaping and lawn care services?
Well, I have a wish. I hope they can start next week because my lawn looks terrible already. Um, but our thoughts. There's a number of people, and we have got clients in that space that in certain jurisdictions. For example, here they can't work in Michigan. Interestingly enough, I can go into Toledo and cut lawns. So same thing with selling cars, which is kind of an interesting one by itself, since we're the car capital of the world. And I can go to Ohio and I can go to a Jeep dealership, but I can't go to one in Monroe, for example. So I think the landscape, I'm optimistic that, the current, for all those of us in Michigan here, the current stay order expires next Thursday. We're being, cautiously optimistic that the governor is going to release some of those restrictions. Obviously, it's going to last somewhat longer, but we hope that the landscaping and related space may have the opportunity with some best practices to get to work. Because when you think about it, at the end of the day, I'm sure everybody's heard the argument, and if you had the argument for the last couple of weeks, working outside in the open air, 3 people on a crew on 3 acres of lawn is much, much safer than standing in the line at Costco.
That's for sure. From Noel, can a new hire count towards the retained percentage of payroll costs for the PPP loan if we let another individual go?
Yeah, so that's a great question. We are expecting some additional guidance on the utilization of the PPP funds. Right now, if you do a liberal reading, though, of the limited guidance that we have, there was the average employee question component that went into the loan application itself, the average compensation on the trailing 12 months that went into the calculation. And so those, we do know this, those factors are going to be part of the forgiveness component. What was not part of that is it was the definition of, give me a defined list by Social Security number, for example, of the 89 employees and their wages in order to meet the eligibility for having that loan forgiven down the road. So theoretically, if you follow the current rules, if I had 89 employees and I had a payroll of $1.5 million and I have to allocate 75% of that towards generally that expense, when I ask for forgiveness, if I have somewhere, our expectation is if I have somewhere around the 89 employees, don't have to be the same, and I'm on a run rate for the 8 weeks for the 1.5, then I'm probably generally within the range of being qualified for forgiveness on that piece, right? If that's 75, at least using 75% towards that expense.
Makes sense. Another question that was emailed over from Debbie. She's wondering how all of the package pieces work together. Unemployment, PPP loan, work share. Does participating in one cancel out the other?
That's a really good question, because when they first issued the rules and we started applying for these loans, it was fairly clear, actually, for example, that you couldn't take advantage of the deferral of Social Security taxes if you were, at the time, the only rule is if you got a PPP loan. So you had a lot of small business were saying, I don't want to take the chance of not having loan forgiveness, so I'm not going to do that. The rules were cleared up and came out about a week late last week and said, yes, you can take advantage of deferring Social Security payments through the end of this year, so long as you have not yet had forgiveness on your loan. So we have some clients, for example, that we're working through that. They've received the loan. They're also continuing to defer Social Security payments, and then there's some other things that they can take advantage of too. But you want to make sure that you're being very focused on the final guidance, so that you're not inadvertently putting yourself in a position that you go and say, hey, I'd sure like to have that loan, that $1 million loan forgiven. And you say, well, yeah, I can't because you didn't do X right. So there is a myriad of opportunities out there, but you want to make sure you're interconnecting them. You don't want to give up any other opportunities down the road.
Absolutely. All right. Any other questions for Craig? This has been such a great conversation and so many good questions that I know a lot of us have had for a while. But I want to make sure that I give everybody one last chance to type one into the chat. If you've been thinking about something, now is your opportunity to ask Craig before we let him go for the afternoon. Okay. Well, we do want to thank Craig for being here today and for Tryon Solutions for supporting today's, oh, I have a question coming in from Dale. Do we get CPE? No, Dale, these conversations, our weekly roundtables, do not qualify for CPE. These are just an opportunity for you guys to ask someone in the know specific questions. He's saying that's not fair. I apologize, but no, this is really just a service, a way to connect our members to some people who have some answers that hopefully we're able to get questioned. And Noel thanks you for all of the valuable information, Craig, as do we all. Thank you so much for being here. Thanks so much again to Tryon for sponsoring this roundtable today and supporting it with all of this wonderful information. Thanks to everyone for being on the roundtable discussion today. We, as always here at the MICPA, are just either a phone call or a quick chat away if you have questions, if there's anything we can do to help support you in all of the work that you're doing to support our business community as CPAs. We're still exploring our topic for next week's roundtable, so stay tuned for that. And going out into the first week of May, it looks like we're going to have a discussion on really focused on some corporate finance issues, trying to close the books remotely, having some staff possibly back in and some of your staff working remotely. What does that all look like? So that's something that's going to be coming up in May. Like I said, next week, stay tuned. We'll hopefully have another great topic for you next Thursday. So again, thanks so much to all of you for participating. Thanks, Craig, and stay safe and stay well.
Thanks, Jody. Appreciate it. Have a great day.
You too.
All right. We'll talk to you soon.